we are going to look at different types of anemias. So we will divide anemia into three subgroups like normocytic anemia, another one is microcytic anemia, and the last one is macrocytic anemia. Normocytic anemia is the word there is normochromic normocytic anemia, and MCV is between 80 to 100. In microcytic anemia, MCV is less than 80, and macrocytic anemia there will be MCV more than 100, and there are different types of all these anemias according to the basis of MCV. So here there are no differentiation between types, but anemia is a mixed decrease RBC count or decrease hemoglobin level results into hemoglobin below normal level. It is called anemia. Blood loss anemia is the type of anemia in which RBCs are small sized and contain less amount of hemoglobin. So that is why they become they can become microcytic and hypochromic when HB is low. Causes are chronic blood loss or chronic diseases can result into hemorrhage, and person will not be able to absorb enough iron from GIT. Any GIT disease or hemoglobin is rapidly lost, and the patient will have small sized RBCs, and that small sized RBCs contain little amount of hemoglobin. Next one is aplastic anemia. Aplastic anemia, the word aplastic indicates there will be bone marrow aplasia. Lack of functioning of bone marrow results into anemia. Causes are bone marrow aplasia, destruction by gamma rays, X-rays, chemicals, drugs, and toxins can result into aplastic anemia. Now, megaloblastic anemia is called macrocytic anemia, and macrocytic anemia, as I told you, MCV is more than 100 and maturation failure will be there. An example is pernicious anemia. It is anemia erythroblast are hypersegmented neutrophils with uh, uh, causes of megaloblastic anemia is lack of vitamin B12 level, folic acid level, and lack of intrin- intrinsic factors result into megaloblastic anemia. Now, as the word indicated, is pernicious anemia. When intrinsic factor is deficient, gastric mucosa atrophy results into B12 cannot be absorbed from GIT, and it will result into megaloblastic anemia. This is why we prescribe vitamin B12 level to the patient having pernicious anemia. So, in this way, another one is hemolytic anemia, means when RBCs are damaged, destroyed inside vessels, hemolytic anemia. So it occurs because of hereditary spherocytosis. As the word spherocytosis indicates, RBCs will become spherical, balloon shaped. Normal RBCs are biconcave, and spherocytic anemia RBCs will become spherical. Sickle cell anemia is RBCs contain hemoglobin S, and hemoglobin S precipitates into long crystals, and when there is mutation, these crystals give sickle cell RBCs, and these sickle cell RBCs uh, stuck in vessels, and it results into different capillary blockages and blood flow problems, which results into death. So sickle cell anemia is genetic inherited. So in this way, this is also a type of anemia. Now what happens when RBC count is decreased? There will be decreased viscosity of blood. Blood viscosity decrease results into peripheral resistance, and it results into less cardiac output, and heart will have to put more effort in order to deliver blood to the organs, and this results into hypoxic damage of tissues, and ischemic damage of tissues results into necrosis, and organs start getting damaged. So in this way, anemia causes harm to our body.